other causes of death, whom do you resuscitate? Although victims retrieved from death are the most reliable source for analyzing possible experimental trips to heaven or hell and back, increased CPR training among the populace has placed resuscitation in the general public marketplace, where an all-out grasp at survival is frequently meticulous, but on the other hand, rare occasions may result in thankless prolongations of terminal illnesses or a limited recovery which results in a permanent vegetative coma. Decisions for resuscitation relate to the cause of death, and for this reason the most common causes of death will be briefly reviewed. Who would you resuscitate out on the street? The decision can be difficult, but when in doubt, resuscitate. For example, Mrs. Audrey Mullins, a 28-year-old mother of two, came to the emergency room of Hutchinson Memorial Hospital in Fort Oglethorpe, Georgia, unconscious and cyanotic. Heart and breathing had stopped, although her pupils were widely dilated. The young emergency room doctor continued a meticulous resuscitation. Widely dilated pupils, I said over his shoulder, the classic sign of brain death. Do you know that? The doctor nodded and shrugged. Call me when you give up, and I'll sign the death certificate for you. I closed the door and went down the hall to another patient. 15 minutes later, the phone rang. She's sitting up and wide awake, he exclaimed excitedly. You better come over. Sure enough, Mrs. Mullen was sitting up and beginning to talk coherently. By the next day, she was walking around on the ward, still with these huge dilated pupils. They were from a herbicide that she had used to spray in her garden. The point is, widened pupils do not always represent brain death. No thanks to me, this woman is living today and raising her two children. She incidentally, like half or more of the other resuscitees, said that she had no afterlife experience at all. Whom then do you resuscitate? Every case must be quickly evaluated, since the brain only has 4 to 8 minute survival time without blood flow. Victims of accidents, the fourth most common cause of death, are always a must for CPR in witness choking or drowning, but you wouldn't want to see it used in cases of crushed skulls and mangled bodies. How about strokes? Some stroke patients recover fully, while others die or become severely incapacitated. In doubtful cases, you might try, since strokes affect nearly 500,000 Americans each year, killing 1/3 of them, leaving the other 1/3 severely disabled and allowing the other 1/3 to recover nicely. How about a bleeding stroke? Paul Hogan, alias Crocodile Dundee, suddenly burst a blood vessel in his brain while trying to bench press 290 pounds in Sydney, Australia, in a gym. Terrible pain, he said, the room going out of shape and the ceiling lifting up. But in Hogan's case, he recovered without any resuscitation. He now says, it makes me appreciate every day as it comes along. Would you resuscitate an Alzheimer's patient? Not if the family has signed in advance a directive requesting that no resuscitation be done. But suppose there is no family, no directive. Alzheimer robs its victims of memory and reason, afflicting 4 million Americans and gradually leading to total disability and killing 100,000 per year. How about the AIDS victim? Would you resuscitate them? The patient might want you to, but professional rescues try to use ventilation masks to prevent oral contact with unknown victims. I just want to say, this is copyrighted in 1993. So, this is dated. Anyways, carrying on. While herpes, fever, blister, disease, and TB have been transmitted by direct mouth-to-mouth breathing, no HIV transfer of infections has been reported. Nevertheless, the Center for Disease Control estimates 1.5 million Americans are currently HIV positive, 165,000 already manifesting the active form of disease, with nearly 65% already fatal. If resuscitated, you must remember they will die again. How would you recognize the manifestly contagious AIDS victim? Be suspicious if the victim has inexplainable weight loss, as if he or she had cancer. The AIDS disease was correctly named slim or skinny in 1982 when it was first discovered in fishing villages along the shores of Uganda, Lake Victoria. Other characteristic manifestations would be black spots on the outside or white spots on the inside. But who's going to look inside the mouth or delve into other orifices looking for white spots before doing CPR? Similarly, would you resuscitate a cancer victim who has no hope? How would you know who is curable and who is not, unless you have documentation in hand? About 76 million Americans now living will eventually have cancer. This amounts to 1 in 3 people will involve 3 of every 4 families. This year alone, the rate of death in the United States will be about 1,400 per day. But some can appear externally healthy when cancer is internally spread everywhere. Some people say such victims should be resuscitated to be better prepared for death and then die again. Briefly, the most common cancer is now lung cancer, occurring in more women than men because women now smoke more than men. Breast cancer will affect 1 out of every 9 women today, while in men, cancer and the prostate will strike 1 out of every 11 males. 80% after the age of 55, cancer of the large bowel maintains the same rate as it has in the past, while cancer of the pancreas is the silent one, involving the digestive organ deep in the upper abdomen. While the pancreas has become the 5th leading cancer killer, there is no cure. By performing the simple statistical review, perhaps you have an inkling of the most likely cause of your own death, and are more mindful of the dilemmas presented in CPR. Finally, there are 4 simple questions usually found in the lips of dying patients. Sometimes they are unspoken. The first is, what will be the cause of my death? But this is usually evident to them by the time they enter the hospital. The second is, what does it feel like to die? We will discuss this in the next chapter. The next is the third question, is there life after death? The final question, is it safe to die? What is your answer to the dying patient and to yourself? I just want to add again, this was in 1993. Everything was different back then. I mean, AIDS was totally handled different back then. And if you have any questions about these things, I know you know how to Google, most of you. And you're intelligent enough to go and find out the updated version of what these things are here. So, but the reason for reading this book is not necessarily these statistics here. They're interesting, but the thing we're trying to figure out is about what happens after we die and what this man found out. I'm just adding that. Okay, so that's the end. Going on to chapter 2, God willing.